Hello, my name is Andrew Bowskill and I am Director of Stakeholder Engagement for Queensland at MTPConnect and Co-Chair of the Australian Antimicrobial Resistance Network, or AAMRNet. And I'm delighted to have this opportunity to be part of this fantastic event and talk about our organisation and the action we are taking on AMR in Australia. Before I start, I'd just like to quickly acknowledge a number of our supporters and partners who are also taking part in the AMRelay, including the CSIRO, Monash Centre to Impact AMR and COAD. The Medical Technologies and Innovation Industry Growth Centre, MTPConnect, was formed in November 2015 as part of the Australian Government's Department of Industry, Science, Energy and Resources Industry Growth Centres initiative. We are an independent, not-for-profit organisation distinct from government that is championing a sector-led approach to accelerate and boost the growth of the medtech, biotech and pharmaceutical ecosystem in Australia. And we work with all these stakeholders that represent the entire MTP value chain to achieve the following 4 outcomes. To increase collaboration and commercialization across the sector, to improve management and workforce skills, to improve access to global supply chains and international markets, and we work to optimize the regulatory environment. And we do this in 3 separate ways. Firstly, we are an independent voice. So we are not a membership organization, so are seen as an independent and trusted voice when we engage with stakeholders, including government. Secondly, we take direct action through delivering and supporting education events, engagement and collaboration activities, and programs that drive collaboration and build commercialization expertise. And thirdly, we deliver strategic funding through our 5 separate programs. And MTPConnect has been incredibly successful in leveraging our original $15.6 million source funding. And all told, including industry contributions and external investment, MTPConnect's work has seen over $300 million flow into Australia's MTP sector. We are supporting over 100 projects across all our strategic granting programs, and as they continue to roll out, that number will continue to grow. A key initiative on AMR that MTPConnect supports is the Australian Antimicrobial Resistance Network, or AAMRNet. And I'd like to give you a bit of background as to how this network came about. So back in 2018, Medicines Australia, the peak body for the innovative pharmaceutical industry in Australia, attended a workshop to inform the Australian National AMR Strategy 2020 and beyond. But there was very little other human health MTP industry representation, and this was despite a strong willingness from industry to engage. So MTPConnect took action to address this by holding a workshop in late 2019 that brought together the key stakeholders from industry, government, research, and clinicians. And the outcomes of that workshop were then published in a white paper called Fighting Superbugs. The workshop and white paper focused on product development gaps and strategies for incentivizing investment and addressing the market failure that is hindering antibiotic research and development. It came up with a number of findings and recommendations to combat AMR. And one of these was it identified the lack of a multi-stakeholder network to really drive the issues around AMR in Australia. So MTPConnect again took action to establish the Australian Antimicrobial Resistance Network and committed up to $300,000 from its Growth Centre project fund to make it happen. And we were also very grateful to get additional support from Pfizer Australia, MSD Australia, GSK Australia, Medicines Australia to help establish the network. Additional supporters have since come on board, including the CSIRO, Botanix Pharmaceuticals, Recce Pharmaceuticals, SpeedX, BioIntellect, and the Monash University Centre to Impact AMR. AAMRNet is an industry-led inclusive network that will support and promote Australia's role in the global fight against the growing threat of drug-resistant infections. It will also enhance Australia's ability to participate in and collaborate with international alliances, and this has been demonstrated through messages of support from and continued engagement with international organisations such as the AMR Action Fund, CARBEX and GuardP. We are certainly very excited about AAMRNet, which we hope will continue to grow its membership over time and position Australia at the leading edge of the global effort to combat AMR. So to tell you a bit about how the network works. So we have a draft work plan which members can input into, and then the steering committee prioritises projects to move forward with. And then we take action on the key priorities. So the current key priorities, we've received additional funding from the CSIRO to explore the potential to establish an Australian AMR accelerator, which could support applicants for grant funding opportunities, as well as facilitate foreign direct investment from companies wishing to access Australian AMR expertise and infrastructure. As part of that work, the network is working on conducting an audit of AMR R&D capability and infrastructure in Australia. We're again collaborating with the CSIRO to develop a report that explores how we can better measure the impact of AMR in Australia, as we know that because AMR deaths can be hidden behind other conditions, the commonly referenced OECD figure of 290 deaths per year due to 8 resistant bacteria in Australia is likely an underestimation. The network has also formed a working group on pricing and reimbursement that is looking at new and innovative funding models and ways of better valuing antimicrobials to support incentivizing R&D, translation and commercialization. The working group is considering various pull incentives such as regulatory incentives and funding options, including overseas initiatives like the NHS NICE subscription model and the Pasteur Act. And AAMRNet is also working to develop a report on the impact of AMR on Indigenous and remote populations in Australia. In addition to taking action on the key priorities I've just mentioned, AAMRNet has managed some significant achievements since it was established just over a year ago. So we held a successful launch event back in September 2020 and received messages of support from national and international key opinion leaders, including the Secretary at the Australian Government Department of Health, Dr. Brendan Murphy, the Chief Medical Officer of Pfizer's Hospital Business Unit, Dr. Paul Vandenbroek, GuardP's Executive Director, Dr. Manika Balasagaram, and Kevin Alderson, Executive Director at CARBEX. The launch was very well attended with both national and international attendees, and we received prominent press coverage, including in the national broadsheet newspaper, The Australian. AAMRNet has also been able to have high levels of engagement, including with the Australian Government Department of Health, who have presented at one of our membership meetings, and internationally, including with GuardP, a partner of AAMRNet, and whose Australia's representative sits on our steering committee, and the AMR Action Fund, who's also presented to the network membership. We also have had wide representation in the AAMRNet through bringing together research, government, industry, large and small companies, and not-for-profits, and we have wide geographical representation across Australia. We've also made several submissions to federal and state government inquiries. These included the inquiry into approval processes for new drugs and novel medical technologies in Australia, which we were subsequently invited to appear at a public hearing, which was attended by my co-chair, Dr. Dan Grant. We've also made a submission to the Medical Research Future Fund's priorities consultation, as well as making a pre-budget submission to the 2021-22 federal budget. And we've also recently made a submission to the Victorian state government's consultation into developing their first strategy on AMR. We also have a growing membership and strong governance with a steering committee that's co-chaired by MTPConnect and made up of key opinion leaders from Australian industry, academia, clinicians and government. So what have been the keys to the success of the AMRNet to this point? Well, I really think MTPConnect has been a key to all this. It listened to stakeholders, it recognized what was needed, and it acted on recommendations by bringing together all the key stakeholders together, and it has really driven the initiative. MTPConnect is independent and not a membership organization, like I say. So it has strong existing relationship with government, particularly the Department of Health, through several of its strategic funding programs. It really is a trusted voice that government listens to. And we have willing participants. We have some exceptionally motivated people in Australia with a genuine interest to make progress on AMR. The people involved are willing to donate time out of their day jobs to be part of AAMRNet and to work to achieve outcomes. And the former CMO and now Secretary of Health, Brendan Murphy, has said publicly on a number of occasions now that he has a real interest in the topic and demonstrated that in his message of support for the network. And Australia has a national strategy on AMR, which the government is taking real steps to deliver on, and allocated over $22 million in the October 2020 federal budget to support the delivery of that strategy. So what are the future challenges for the network? Well, the first is sustainability. We want this network to last. We want it to grow, and we want it to deliver an ambitious work plan. And that takes appropriate resourcing. And we want to maintain and grow interest in AMR. And then there's COVID-19. COVID I see as both a challenge and an opportunity. There rightly has been lots of focus on COVID, and considerable effort and resources are being directed towards it. So the challenge is to ensure the voice of AMR remains heard. But it is also an opportunity because it's highlighted the critical need for access to healthcare. It's also the first time I've heard so much public talk of the direct link between a healthy population and a healthy economy. Also, and really importantly, it has shown us what is possible when people collaborate and effort is directed towards a common goal, and that can be done with AMR as well. So to celebrate World Antimicrobial Awareness Week, MTPConnect has released a special series of podcasts. These podcasts highlight the activities of several Australian organisations working on innovations to help combat AMR. All our podcasts are available on the MTPConnect website. And in addition to this series, there's a couple more on AMR, including one on the launch of the AAMRNet, an interview with Adrian Towles, and one on an outbreak economics report on the impact of antimicrobial resistance. You can connect with MTPConnect and the AAMRNet a few different ways, by email or telephone and via the usual social media channels. So thank you again for the opportunity to present at the AMR Relay, and I look forward to collaborating to progress action on AMR. Thank you.